Okay, so this is a suspicious segment that we're having it. So in our diagnostic test, I said we could see if we could deload it instead of just a general traction. That we could, what we want to do is flex it and gap it. So it's a double technique. So we're giving it the widest range at the foramen. All right. So now if we have a healthy we're not in the 75-year-old or the osteoporotic or somebody else. We'll just start with the general test. So we're going to flex it up to the segment. If we can, we're going to axial rotate. Now, if we're dealing with stenosis or an elderly stenosis, and we should have had your side, let me just come right in here. What you can do is come right here. That's axial rotation. Okay, very gentle on the older patient or the degenerating spine. So we're right there, and now straighten your bottom leg just a little bit like that. Okay. What we want to do now is we've got that. There's the flexion moment. Yes. There's the gap. Can you see that? Okay. So we take it down, and now we're opening it. So when we're doing it as diagnostic, does that give you pain relief? That's very specific to that nerve, and we can come opposite and we can close it, and that should bring the pain on. Okay, so that was part of our diagnostic criteria. So now in treatment, what works very well is to flex, gap, and you're going down the line of the femur. Okay, and it's a long hold. We can do intermittent oscillations like we do with traction. What's the use of intermittent oscillations?
Pain relaxation.
Yeah, and to pumping action for the inflammation. Okay, or we can hold depending on how painful it is. Now, you may hold this on somebody. This might be their first pain relief. Okay, now if it's acceptable, Fred, can I have you?
Yeah.
What I've also done, and it's really helpful, is you're going to come right here, Fred, and what you're going to do is you're going to kind of, yeah. So we're going to add a little control, and we're going to open that maximally, like that. And so I've had some of my staff, they might sit on the floor and either hold a leg or traction it, so we can hold this for a period of time. Okay, so you might be doing this for 3, 4, 5 minutes, and this might be the most pain relief they've ever gotten. And so that's a very nice technique. And then, of course, if we found that relief, now we can teach that patient how to position the gap in sleeping. Okay, so we position them so they could find a relieving posture so like with all stenosis, we have it so narrow that we can't get relief, and that means that it's closed so much that we probably are interfering with some of the electric conduction down the leg, but most of stenosis is inflammatory. It comes and goes. That's why we inject it or they steroid it. So when we're dealing with an inflammatory moment, you're going to treat it like that. So if we can pump it, gap it, and let it settle down, you can get a long ways, and then teaching them protective posturing with that. Anything else? Eric, anything else? Whatever you want. Okay.